Welcome back, dear viewers, and our first guest of the evening is Dr. Hala Najeed, ophthalmologist and fellow of the Royal College at Glasgow. Dr. Hala, welcome back to AziadiQ8, and it's really a pleasure to have you tonight with us.
Thank you very much. It's always my pleasure to be here.
It's always our pleasure. So we're talking about cortisol and it's as a treatment.
Yes.
And how does eye drops of the cortisol works exactly?
Okay, let's talk about cortisone or steroid-containing eye drops. Those are the most common eye drops that we prescribe in the clinic next to our lubricant drops. So how do they exactly work? They soothe any type of inflammation affecting the ocular surface and the eyelids. So it down-regulates any inflammatory mediators and provides a very rapid soothing effect for the patient.
So that's the dexamethasone. And also, when will I feel better if I get this treatment?
Actually, the dexamethasone that you mentioned is one of the most commonly used types of topical cortisone. You will feel better within just a few days of using the topical dexamethasone eye drops, maybe 2 to 3 days.
I believe, Dr. Hala, you know, sometimes when it comes to eye treatments and how we fix our vision, it needs and requires a lot of, let's say, post maintenance, or the patient must be careful when it comes to their vision.
Of course.
Taking care of a lot of things around us, and also in our work environment, and also in the environment outside. So are there any long-term side effects when it comes to the post-treatment?
Yes, of course. When we talk about cortisone in general, many patients become very concerned that they will have some side effects. I have to reassure everybody that using cortisone-containing eye drops under medical supervision is completely safe. Some side effects can happen, like an acute rise of the eye pressure, and also sometimes using those drops without a doctor's consultation can lead to cataract as well. So we can use them safely by just by adherence to our follow-up with the doctor.
Some of the patients, as you know, doctor, sometimes they avoid the treatment, or sometimes they decide to stop it without any consultation.
Yes.
And a lot of people are worrying, or they might feel curious also, what might happen, what will happen if they stop using it?
Usually, if we use it for a short period of time, nothing significant will happen if you stop it suddenly. But usually for steroid eye drops, we like to taper them, meaning that we will reduce the frequency gradually until the doctor will tell you to completely stop the drops.
And also, doctor, we're wondering, one of the treatments you absolutely know about, doctor, when it comes to the eye and the sight, dexamethasone eye drops, sometimes it gets combined with an antibiotic, and there's a special usage for it. Does it happen always, or for some special cases?
Mostly we use combined dexamethasone with antibiotic drops in cases of bacterial infections of the ocular surface, either bacterial conjunctivitis or bacterial blepharitis. So this is the main indication of using a combined type of drops.
And what about, Dr. dexamethasone? Is it made specifically for eyes, or like as eye drops, or it can be used also in the ear?
Actually, most of the ocular products are very safe to use for your ears, but usually we don't recommend that you do this unless upon a doctor's consultation. And
what about, there's a lot of also concern when it comes to contraception.
Yes.
Does it affect the contraception?
Actually, it doesn't affect contraception or pregnancy or lactation. The percentage of absorption of those topical drops into your systemic circulation is very, very low. So women on contraception or pregnant women shouldn't be worried about using the steroid eye drops.
Definitely. And as you know, doctor, the weather is getting good, and it's getting beautiful, especially at the evening and early in the morning. So a lot of people, they exercise outdoors, such as jogging, or also drive or ride a bike. Does it affect them? the people who are getting this treatment?
If you are using steroid eye drops or actually any type of eye drops, this can cause a very transient visual disturbance or blurring of vision. So we recommend that you wait at least for half an hour before you ride a bike or before driving your car. But there is no long-term blurring after using the drops.
Definitely. Doctor, let's go back to technology.
Okay.
Now, as you know, the patients are getting more aware and they get more information through the internet and the social media and through the search engines. They read more. And when it comes to our daily lives, we always involve nutrition and living a healthy lifestyle. Of course, a lot of your patients, they ask you about the food or drink they need to consume and the food and drink they need to avoid during this treatment.
Okay, so to make it very simple, this type of drops, all types of steroids, which include dexamethasone, prednisolone, and loteprednol, they don't interact with any type of food or drink. So it's completely safe to maintain your regular diet while using the drops.
Well, that's really great. Thank you so much, Doctor, for being this evening with us on Hala Kuwait, and thank you for the valuable information you shared with us. And we wish you a happy weekend.
Thank you very much. Always my pleasure.
The pleasure is ours. Thank you, Doctor. The viewers, we just had with us Dr. Hala Najeed, ophthalmologist and fellow of the Royal College at Glasgow. Let's go now, share with you our third report of the evening. It's about cybersecurity. We have a look at it. We'll be right back. Stay tuned.